now, Professor Ines, President of the Arabic Association of Diabetes and Metabolism, is going to give us a presentation of Egyptian diabetes. Thank you, Professor Ines.
Thank you, Mr. Chairman. I'm going to talk about diabetes in Egypt. And diabetes is a fast-growing health problem in Egypt with a significant impact on morbidity, mortality, and health care. Egyptian physician Hasira, the first one who described diabetes 3,000 years BC. But diabetes was first written in a papyrus called Ebers Papyrus after George Ebers, the German Egyptologist who discovered this papyrus and translated it from hieroglyphic language to the modern language. This papyrus was written 1550 BC. They described a condition of passing too much urine. And this was the first description of diabetes in the world and the discovery of diabetes as a disease. They also, our grandparents, the pharaohs, they described treatments, remedies for diabetes from mud and from other things. So we have a long history with diabetes in Egypt. In the modern era, diabetes continues to be a public health problem with a significant burden on the Egyptian economy. For Egypt, the IGF ranking to be in the 8th in 2015, but we are expecting new data by the end of this year in IGF Abu Dhabi. We were supposed to have 7.8 million diabetic patients by 2015. Other estimates and surveys said that it's not 7.8 million. It's 11 million diabetic patients. By 2040, we are going to have more than 15 million patients with diabetes in Egypt. This is the IGF rank. Egypt in the 8th rank and expected to be in the 7th rank by 2040 if we do nothing to prevent this increasing prevalence. This figure shows the increased prevalence of type 2 diabetes from 2007 to 2011. Around 15% of adult population above the age of 20 and expected to increase again to reach 18% by 2030. And for the number of type 2 diabetic patients, we were having 4 million, more than 4 million diabetic patients by 2007. In 2013, 7.8 million, according to this survey, and expected to increase to 13 million by 2035. Rural population with more traditional lifestyle, eating vegetables and walking for long distance, they are having lower rates of diabetes risk factors and diabetes. While in urban population, and particularly those with higher socioeconomic status, they have higher rates of both risk factors and diabetes. So we are having 16% of adult Egyptians with diabetes and 8% are having prediabetes. So diabetes actually affects 1/4 of the Egyptian persons. Are these diabetics diagnosed or not? Approximately half of the diabetics in Egypt are diagnosed and remaining half is not diagnosed. What about the health expenditure? We find that the cost of ambulatory care is one of the lowest in the region, but the cost of managing complication is one of the highest costs, because we don't pay a lot to treat the patients properly and to investigate and to make the routine checkup and self-monitoring of blood glucose. So we are facing higher cost in managing complications. And there is also a direct cost of diabetes and indirect cost of diabetes due abstinence from work. The annual cost analysis estimated that economic impact of type 2 diabetes in Egypt was $1.29 billion in 2010. $1 billion, not Egyptian pounds. This number excluded the cost of pre-diabetes and the cost of loss of productivity due to absence from work. Most patients with diabetes in Egypt are treated out of their pockets. They are paying money for the doctor visit, the hospital, and also for the medication. Most of our patients, we all know that. The insurance in Egypt is not covering everybody. In the limited number of academic hospitals, yes, in university hospitals like our hospital, Cairo University Hospital, we are having a diabetes center, and there is some specialized diabetes centers in Cairo and other major cities. What about the etiological factors? During the past 20 years, there was major socioeconomic changes. Life expectancy has improved dramatically due to social care and medical care, urbanization, and per capita income has increased. The changes in physical activity and dietary pattern have promoted the development of diabetes. Inactivity and high energy diet. Obesity, especially visceral obesity and physical inactivity, and Egypt is currently the third highest prevalence of obesity in the MENA region, having the third highest prevalence after Saudi Arabia and Emirates. Sedentary lifestyle, increasing number of cars. Our traffic is congested due to high use of cars, and every family is having 3 cars, 4 cars, 5 cars. We all know this, and this contribute to decreased physical activity and daily activity. And Egyptians have tendency towards avoiding exercise in public places, especially females. Due to some traditions, female are not encouraged to walk in public places like gardens and clubs and so. But the major sport in Egypt is soccer, and soccer is played only by teams and by men only. So Egyptian females are actually less exercising, especially in high socioeconomic status when they go to certain clubs or certain gyms. Swimming and biking are becoming more popular in higher standards and in sporting clubs. Even in schools, reduce time for physical activity. Usually in schools, they take the time of physical activity to give some extra math session or extra history or geography or something like that. And there's also reduced exposure to sunlight in spite of the sun we are having in Egypt. There is reduced exposure due to the traditional clothing of the females. This will lead also to vitamin D deficiency, which is prevalent in Egypt. And this vitamin D deficiency has been linked lately to higher rates of obesity and type 2 diabetes among Egyptian females. What are the strategies to improve diabetes care in Egypt? The government, through public awareness plans, should implement an efficient screening program among high-risk patients. There should be a national screening program, educational program, self-management plans, general diabetes and nutrition education in schools and in universities. Public and private media should help, and they actually help, about how to improve the dietary habits, how to reduce the consumption of processed food, fine carbohydrate, and trans fat in traditional Egyptian meals. Let me now give you an idea about what we are doing, the Arabic Association for the Study of Diabetes and Metabolism, and we are inviting all of you to share in our activities like scientific activities, conferences, workshops, educational flyers, nursing education, patient activities in different places. We can help you in your work, in your place. Patient education sessions, increasing awareness, blood glucose testing, distribution of educational material, educational CDs. We are now preparing a CD for patient education, and try to get your copy to show to your patients, flyers, booklets, and newsletters about healthy lifestyle, distribution of glucometers to those who can't get glucometers, glycosylated hemoglobin management, measurement. We are having fund to make hemoglobin A1C in any place if you are joining our activity. Media awareness program, TVs and newspapers, interviews and articles periodically. Religious fasting, you know that we are doing once a year one-day conference about Ramadan, and we also did some activities in churches about patient education and screening. Refugee activity, we were talking about disaster medicine, and we are making refugee activity in collaboration with the United Nations High Commissioner of Refugee about diabetes education, glucometers and test strip distribution, blood glucose analysis, hemoglobin A1C measurement, fundus examination, financial support and food supplies to refugees living in Egypt. As we said yesterday, we are sharing in the Berlin Declaration, the Global Health Policy Forum under the supervision of the International Diabetes Federation and the WHO. AASD and Egyptian MOH are the only two parties chosen from Egypt to represent Egypt in Berlin Declaration. The first phase, 200 days going on from December 2016 to October to next week, and it is a very ambitious diabetes campaign. One of our World Diabetes Days 2 years ago. In conclusion, prevention, early identification and effective intervention are integral components of effective type 2 diabetes care in Egypt. These strategies may reduce the expanding economic burden associated with type 2 diabetes care. Thank you. شكرا لحضرتك.
Thank you, Professor Ines, for this very interesting presentation about the activity done in Egypt and the prevalence of diabetes.